All right, we want to welcome you all to our media briefing here today on the 21st of April. We're talking today about testing. You are seeing right now all of these panelists shoulder to shoulder because this is a huge collaboration in our community, but we are going to take people out and only show you folks who are speaking so that it's easier for you to record this and use this, our media friends, later as you need to. So we're going to ask all of our panelists, except for our commission president, Tina Skeldon-Wozniak, to please now turn off their cameras. And media, you will be allowed to ask questions to any of our panelists after our news briefing today. And we begin now with our commission president, Tina Skeldon-Wozniak.
Thank you so much, Chris. I'm so happy to be a part of this press conference that's so important for our community. So on behalf of my colleagues, Pete Gerken and Gary Byers, and also I'm so happy to be joined with Mayor Wade Kapsakevich today too, to tell you that we have some good news to share with our residents of Toledo and Lucas County. While we are still all dealing and under the stay-at-home order, at least until May 1st, we are planning for the future. And in this roadmap to recovery, testing is an important highway to give us data that we can use to move forward safely. We're so grateful. Today we're sharing with you an amazing public-private partnership. So we have great community retail partners together with the Neighborhood Health Association, who is going to also share about the public side of this testing and how we can begin the meaningful public testing in our area. So thank you to all the community partners who are going to bring you important information today and how we can move together to ensure the safety and well-being of all of our Lucas County residents. So thank you, and let's hear some more.
Thank you so much, Commissioner, and we will let you turn your camera off and give our Health Commissioner, Dr. Eric Jasinski, time to turn his on, and you're going to tell us, Commissioner, why this testing is so important for our area.
Chris, thank you so much. And again, this is a day for Lucas County and our community. Started this process several weeks ago without having a test, and we had to the strategy we've been using to use that tool we didn't have. We have a very significant tool to help combat this nefarious disease that we have out there. The idea of testing, as we've seen in other countries, they were able to test themselves out of COVID issue where we did not have the ability. So we're going to start having the ability to understand what's going on in our community, like Commissioner Wozniak discussed, is to give us a much better tool and a better handle on getting to the root cause of that really is to make sure that people who are infected can not infect others, or we limit that ability for them to infect others. That is really the way that we're going to, again, stop this disease. So as we know that more people are positive, we then can go ahead and self-quarantine them, look at their contacts. If they get sick, we react to that. So it's going to give our contact file much more ability to, again, stem, hopefully, the tide of infection going out through the community. Data is so important from the health department's perspective. We're all trying to figure out what's going out there, and that's because of that data. And with the ability to test more, be able to have a better handle on that data and understand where we need to resources, but then also too, make sure that messaging that we so much need in health get out the right way. So Chris, I is really testing in a nutshell what we do and why it's so important.
Okay, thank you so much. And now we want to bring into the conversation someone who can explain to us a little more about kind of the logistics of testing. ProMedica has been a big partner in us getting the word out, and there is a hotline you'll hear about in just a little bit as well. So we want to bring in Dr. Brian Kaminsky to the conversation. He's the Vice President of Quality and Safety for ProMedica Health. And I think it's natural, Dr. Kaminsky, that everybody just wants to be tested to find out, do I have it or have I had it? But in this particular round of testing, we really are looking for some very specific parameters of who can get tested. So why don't you tell us about that and why that's so important?
Sure, and thank you for having me. And we all understand how important it is to test, and the Health Commissioner outlined a number of those reasons. Testing helps us drive public policy, I think, is probably the most important reason. But yet that we know as individuals that we all would like to be tested because we would like to know if we've been exposed, and we would like to know if we have the disease, if we have symptoms. And it's important to talk about those two different things because there isn't an infinite amount of testing out there. So we're really exciting that through this public and private partnership, we're able to offer more tests to more people in our community because it is going to create learning and create knowledge. It's going to help us understand the disease prevalence within our community, and it's going to help us target hotspots, and it's going to help drive public policy and help us eventually ease some of those restrictions that are out there. But it's really important to understand the limits of the testing. So the test that we're all referring to right now, it's a molecular test. And what that means is that we're testing for components of the virus that that individual might be shedding at the time that we see the person. So it doesn't necessarily equate with the disease, and it doesn't necessarily mean that you're contagious. What it does mean is that you've either recently contracted the disease or that you're most recently recovering from the disease. So that's what we are currently testing for. And it's also important to point out that the test itself, whether the result be positive or negative, is unlikely to affect the recommendations that we have for that individual. So as you've heard many of times, our recommendations are to stay home, to self-isolate, and to abide by all those restrictions that are in place right now that's keeping people at home and keeping people isolated. Whether you test positive or negative, we still want to enforce those recommendations because the test itself is imperfect. We know that about 25% of people don't have symptoms at all. And we also know that about 25% of people will test negative when they actually have the disease. So the test itself has its limits. The good news is for those people who do test positive, they are very likely to have or have recently recovered from the disease. So our positives are true positives, but our negatives, there are too many false negatives to completely rely on testing alone to drive behaviors and to drive public policy. But the positive tests in their aggregate allow us to understand the prevalence of the disease in our community. So because there aren't an infinite number of tests out there, and to truly understand how much disease is in our community, we're really prioritizing our testing in a way that's consistent with state and national recommendations. We want to test people who are symptomatic. They're the most likely individuals to result in a positive test if indeed it is COVID disease, and that will give us the best understanding of disease prevalence in our community and allow us to feed that information back into our local health department, into our state health departments, and then eventually across the country so that we can make responsible decisions and informed decisions about when to loosen and ease restrictions as we begin to reopen the country.
And one of the reasons that they are starting to report these probable cases is because if you do have those symptoms at this time, you probably are a COVID patient. Is that correct?
Yeah, we have such disease prevalence out there that COVID is a very likely illness if you have the appropriate symptoms. The main symptoms that we see from the illness are fever, cough, shortness of breath sometimes, muscle aches, body aches, and then less commonly, you get gastrointestinal symptoms, so nausea, vomiting, diarrhea. Those are present in about 15% of the population.
Okay, Dr. Kaminsky, thank you so much for being here with us, and stand by. We'll have you turn your camera on, but please stand by to answer some questions. There are 3 retail partners in our area that are going to be part of this testing process, including Kroger, Rite Aid, and Walmart. And in fact, Rite Aid actually began testing yesterday. So we're going to ask Jeffrey Mazinski, the regional pharmacy leader for Rite Aid, to join us now to tell us how the testing is going and what those parameters are that Rite Aid is putting into place. Hi, Jeffrey.
Well, Chris, thank you for inviting me to this conference. Rite Aid is very proud to be part of this as a community effort to help in this testing procedures. You know, we're working in conjunction with HHS, the White House Task Force, and CDC, obviously, in getting this testing done. It is all done by appointment. Yesterday was our first day on site, and we tested 90 individuals. Today, we're potentially going to test up to 200 people. And starting tomorrow, we're ramping up our testing volume up to 400 people in the day. We've got a pretty good system going, almost a well-oiled machine right now. And it's worked out very well. There's a lot of great attitudes, and everybody is working in a collaborative manner to get it done.
Okay, and you actually had how many people yesterday through your?
Yesterday, we tested 90 people. The results of our test are sent to an outside healthcare firm called PWN, and they will get the results back to the patient in, they say 2 to 7 days. We are hearing reports it's closer to the 2-day mark. If they are positive, they'll get a phone call from a member of the clinical team at PWN. If they are negative, they'll get a response on email only.
And you have already had people make appointments for the next several days ahead, correct?
Right. The way it works is people will go to riteaid.com, our website, and there's a link to COVID-19 testing. We work with a company called Verily, which is a division of Google Alphabet, to handle the logistics of the screening questionnaire and the scheduling of the appointments. And every day we schedule through 1 o'clock today for appointments for the next day. And if the next day fills out, then we continue going on down the line. The last time I checked a little while ago, we were full until about 3 o'clock tomorrow, and we're open till 5. So there's still some slots open for tomorrow, but that got cut off at 1 o'clock today. It's a very simple questionnaire. I've done it myself. We're prioritizing, obviously, CDC priority number 1 and number 2, first responders, healthcare workers, people over 65 that are symptomatic. And the questionnaire is very simple to fill out and complete it. And then you get almost an instantaneous response of your eligibility, and then be offered a couple time slots that may work out for you to test. And then we have people drive in, come to the test site, show a government ID, plus a verification of the appointment. The appointment, they can either show us their phone or a printout from their appointment confirmation. We are enforcing the date of the appointment. If somebody happens to be a half hour late or a half hour early, we're not worried about that. But if you're scheduled for April 22nd, we can only process it on April 22nd because the requisitions are specific for a given date. But we're ramping up and excited to help in this matter.
And Jeffrey, just to be clear, this is, you make an appointment, you do this as a drive-through, through your drive-through location, and this is a nose swab?
Right, it's a self-administered nasal swab under the supervision of one of our pharmacists that were trained. There's virtually no patient contact. Almost all of it is done with closed car windows, with the exception of when we have to give the kit to the patient, and that's done at the end of a 6-foot table, so we maintain that distance. And then we do a demonstration on how to do it and send the people on their way, and it's worked out very, very well. Every now and then somebody will drop a swab, drop a test tube, and then we have to, get another kit taken care of. But we have had very few problems, great attitudes from both our associates and the public at large, and it's worked out very well so far.
Awesome. Thank you so much for being here with us today, Jeffrey from Rite Aid, and he'll stand by to take questions as well. And now we want to bring in our other retail partner right now. Starting on Thursday, Kroger will be administering tests in our area. So Kroger's Regional Clinical Director, Connie Palacadetti, will talk about Kroger's effort in our community. Hi, Connie.
Hi, thank you for having me today. Kroger is really excited to announce the beginning of our testing for COVID-19 this Thursday, April 23rd. We will be offering drive-through COVID testing. We have partnered with the Lucas County Health Department for a chosen location that best serves our community's needs. We're going to be located at the Metro Park Hawkins Farmhouse, located at 5434 West Bancroft Street for testing. Our testing will run Thursday, Friday, and Saturday, so April 23rd through the 25th from 10 a.m. to 4 p.m. We do anticipate that we will be testing about 1,000 patients over these next 3 days who meet the criteria established by the CDC. Kroger and Kroger Health are focusing on testing for priority 1 and 2, and also now have expanded to priority 3. So testing for the community that's out there. So anyone with symptoms of COVID-19 can be tested at our sites free of cost. In order to make an appointment for testing at our sites, someone would need to visit www.krogerhealth.com/COVID testing. You will then go through a virtual screening to help you figure out whether or not you are a candidate for our testing protocol per CDC guidelines. If the assessment determines that you do need that testing, the next step would be to choose the testing location and an appointment time. After you do that, you would then receive a confirmation email of your appointment. Our drive-through testing locations are also a self-administered nasal swab that is ordered and observed by a provider that is on site for Kroger Health. These test results are available within 48 hours from the date of testing for the patient as well as Lucas County. Kroger has determined that this testing of methodology is beneficial because it increases the amount of tests that we can provide for the communities, but also limits the amount of personal protective equipment that needs to be utilized. So we're saving some PPE. Kroger and Kroger Health is committed to expanding our drive-through testing sites and other locations to provide all the vital needs in our communities with COVID-19. This allows us to continue our mission, vision, and purpose to help people live healthier lives by simplifying healthcare. It's just that easy. These drive-through sites, you drive up, you have your appointment time, you get your swab and move on, and therefore we will be able to call those results to you within 48 hours. So thank you for having us. We look forward to caring for many of you at our sites this week.
Thank you so much, Connie, and thanks for being here, and stand by as you might get some questions. We also want to let you know that a Walmart representative was not able to be here with us this afternoon, but Walmart will be taking over the testing site at the Metro Parks Hawkins Farmhouse site on Bancroft beginning on Wednesday of next week. And again, there are parameters. You have to make an appointment. We'll give all that information to you in just a moment. Our media friends should be receiving it via email any moment now. Again, we want to let you know that this data is very important for our area, and the Ohio Department of Health has really been pushing for this information as they make decisions, and they have also made testing kits available to all the health departments in Ohio counties. And so Health Commissioner Eric Jasinski will talk about how those test kits will be used and administered. Commissioner?
Thank you, Chris. As you see, the increase in testing is coming, and that includes as well. ODH is pushing out us to all health departments, including the Toledo Lucas County Health Department, and so we're very grateful for that. Again, this will continue for the immediate future. There is a limit slide though from the Ohio Department of Health, so that we'll go ahead and as we receive those, we'll be able to put those out. What we looked at was how are we going to start pushing these out to the public? And one of our main concerns here is the underserved population. We've heard the issues of the underserved population, specifically the African American community, and the disparities that are there. And what we really needed to do is figure out what was happening in those communities, but more importantly, again, pushing some of these tests out to that underserved population. And we are so lucky to have Donnie Miller with the Neighborhood Health Association with us to be able to, again, really look at this underserved population and try to make sure that doing everything we possibly can to find out what's going on in that community. The tests we have right now are about 400 that Donnie Miller will be able to go ahead and actually utilize for a set criteria of that underserved population. And what I'd like to do is ask Donnie Miller to come on screen and just talk about where we're going with this, the criteria, and what Neighborhood Health Association is actually going to be able to do for the community.
Thanks, Eric. Really, thank you so much for this partnership. First of all, I'd like everybody to know that this is an incredible initiative, and it would not have been possible without the strong collaboration of the city and the county and the community, which is so important in these kinds of conversations, TPD and both Mercy and ProMedica hospitals. We are all completely and totally committed to the importance of testing in this community. And I'm thrilled to say also to bringing testing to those underserved in this community. We will become, by offering testing to the underserved, one of the precious few in this country to have actually placed COVID-19 testing sites squarely within the reach of those most vulnerable to this illness. What you see today is the best example of how teamwork makes the dream work. So Neighborhood Health Association is thrilled to be a part of this. We'd like to especially thank, while I have a minute to say this publicly, Eric and Matt Sapara for helping NHA manage the millions of pieces that are required by this process. You know, it's really fitting that NHA be in this position today. This organization was started 50 years ago by a group of African Americans in the Central City who were frustrated by the number within their community who were dying because of a lack of healthcare, adequate access to healthcare, and from diseases that could have otherwise been handled had they simply had access to healthcare. So here we are 50 years later with the Neighborhood Health Association in partnership with those folks that I've talked about already, bringing this very important testing to those very communities. And I know they would be proud of what this community has done in response to their dream. Let me tell you a little bit about how the Neighborhood Health Association will proceed. We will be providing tests at both walk-in and drive-up testing to at two of our sites, the Nexus Healthcare location, which is located at 1415 Jefferson Avenue, and our Navarre Park Family Health Center, which is located inside of the East Toledo Family Center at 1020 Varland Avenue. We will have translation services in Spanish available at the Varland Park site. Testing will begin at 9 a.m. This Monday, April 27th, and it will conclude at 3 p.m. On that day, we will be testing regularly on Monday through Friday during those same hours, 9 to 3, until the tests are no longer available. And right now, we're not able to tell you when that might be. We will be testing symptomatic residents of the following zip codes: 43602, 43604, 43605, 06, 07, 08, 09, 10, 11, 20, and some portions of the Holland zip code 43528. I'm sorry. Again, that's 43528. As with most places that are providing testing, you will be required to have an appointment. Appointments can be made by calling 419-214-5700. Now, what's important to know about that is that you cannot start, we will not start taking appointments for the testing until this Friday, which I think is the 24th, at 1 o'clock in the afternoon. If anybody calls prior to that, they will simply be requested to call back at a later time. Spanish translation will also be available for the making of appointments. To help defray the cost of these tests, we will be billing insurance if that is available. But if it's not, don't worry about it. The cost of the test will be covered. So those of you in those vulnerable populations that we are talking about, please, please, please do not let your inability to pay, do not let your inability to have insurance keep you from getting tested. Please use this opportunity to be tested. And also keep in mind, everyone, that while NHA is targeting specific zip codes, the county, as you've heard, is well situated to provide testing to almost anyone in the county who needs it. The reason that we are targeting these zip codes is because the disparity in the numbers of African Americans and brown people and poor people who are contracting this illness are so far and away above those of any other group of folks who are getting this disease. And we are clear, everyone on this call is clear, all of our partners are clear, that unless we get a handle on the spread of this disease in these communities, we are in trouble for a very long time. So again, lots of appreciation to our partners on this call. Those of you out there, please remember that for Neighborhood Health Association, we are specifically targeting those folks in the zip code that I've mentioned. Those are the zip codes that contain the highest number of residents who are Black, brown, and underserved in our county, and an appointment is required.
Donnie, thank you for everything you did to pull this together for our community. We appreciate that so much.
You are welcome.
We want to go ahead and show you the graphic now that shows all of these locations where we have put these testing sites so that you can see them. There are 4 of them at a time. As you heard there, the first is going to be the Rite Aid on Airport Highway in Holland. RiteAid.com is the address there. The second is the Metro Parks Hawkins Farmhouse. That was sponsored by Kroger on Thursday, Friday, and Saturday this week. KrogerHealth.com/COVID testing is the website to get there. The third is the Nexus Healthcare Center downtown on Jefferson, and 419-214-5700 is the number to call to make an appointment. And then the Navarre Park Family Care Center inside the East Toledo Family Center at 1020 Varland. And again, the phone number 419-214-5700. In all cases, you must be showing symptoms of COVID-19, and you also must make an appointment at each of these places. The Metro Parks Hawkins Farmhouse will be taken over by Walmart, the testing there on Wednesday of next week. That website we will put into the comments. Our media should have it, but we'll put it in the comments on our Facebook page as well, so you can see that. And obviously, a lot of collaboration here between a lot of different industries and a lot of different folks, including Mercy Health. And Matt Sapara is the Vice President of Regional Development and Operations at Mercy. He's here with some additional information now. Matt?
Good afternoon, Chris. Thank you. Let me start by saying to Donnie, what an honor and privilege it is for Mercy Health to be partnering with you to ensure that the most underserved and vulnerable in our community are tested, during this pandemic. We're so honored to be part of that partnership. But my message really is one of gratitude and unity. Thank you to Walmart and Kroger and Rite Aid for expanding the community's ability to test our residents. We know how valuable it is to get this data to ensure we know who has it and who doesn't at this point. I also want to say thank you to our partners, UTMC, St. Luke's, ProMedica, who've been with us now for the last several weeks in testing population centers here in Lucas County. Very early on, we recognized the need to move forward in that direction, and we've been busy doing that. Mercy Health and its partner ProMedica stand ready to support the expansion of testing capability through the use of our established hotlines. I believe those numbers are going to be shown on the screen here shortly. But again, whatever we can do to help support this mission to expand the testing capabilities to ensure that everyone that is symptomatic, as Dr. Kaminsky indicated, is being tested, because again, that information is so valuable. I also want to take a second to thank all of our first responders throughout the region. Mercy Health has partnered with both law enforcement and EMS agencies to ensure that all first responders are tested where appropriate. And we're very grateful for the relationships that we have to ensure these men and women are protected. With the expansion of this relationship, Mercy Health has been able to work with some of the largest law enforcement agencies in the community to ensure that they properly fitted N95 masks. Once again, something that we may have taken for granted in the past, but today we recognize how important that is, and we really think that that's a testament to, compared to other communities, how few people are quarantined right now from a first responder perspective. I specifically want to reach out and say thank you to Chief Kroll, Chief Byrd, as well as Sheriff Tharp, and all the fire chiefs that have stepped forward and demonstrated their leadership to make sure that these groups are protected. And finally, I'd be remiss if I didn't say thank you to all of our healthcare heroes at every location and every discipline. I get to see it firsthand, seeing what these men and women are doing to help protect, our community and working with the people that have been afflicted with this horrible disease. I think when this pandemic is finally defeated, the role of the healthcare workers just simply cannot be overstated. We are so blessed to have these heroes walking amongst us. Thank you, Chris.
Thank you so much, Matt. And you are absolutely right. We owe a debt of gratitude to all of our healthcare heroes in our community, as well as other workers on the front line who are making sure we're all safe. And it's that kind of collaboration of all of those workers that has really helped to ensure the safety of people in Toledo and Lucas County. And Toledo Mayor Wade Kapstikavich has been a huge part of that equation and has a few remarks about this latest collaboration here today. Hi, Mayor.
Hi, Chris, and hello to everyone joining us this afternoon. I'm in a position really to reiterate what so many others have said, and that is a general thank you to all of the partners who made this happen. I want to pause and reflect on the significance of today's announcement. Matt Sapera is absolutely right. Because of the leadership Mercy has shown, we've been able to test first responders. Mercy has uniquely stepped up to make sure our first responders and others have had access to testing and the other resources they need to protect themselves. I think back to the night at the airport where 500,000 masks came in. I know Mercy was integral in making that happen as well. The significant thing today, though, is that now we are going to be able to offer public testing in a way that we hadn't been, frankly, maybe this time last week. And as Donnie Miller mentioned, perhaps in a way that not many other communities in the country are able to say. It's not worth, I suppose, litigating the last several months of this crisis, but I do think most would agree that there has not been as much one federal response as there have been 50 state responses and perhaps thousands of local responses. And so it really has fallen to local communities to be resilient and to be creative in how we were going to meet certain needs. That's just the reality of how the response has unfolded. We have, as Donnie mentioned, I think done better than most communities in this country in terms of being able to get our hands on some testing, to make it available to the public at large in a way that is not perfect. I'm sure this plan is not perfect, nothing about the situation we are in this country right now is perfect, but we are providing access to testing for the public. It will go on for several weeks. It's going to provide testing opportunities to historically underserved and vulnerable communities in a way that not many other cities in this country can say on April 21st, 2020. I assure you of that. We're a little bit ahead of the game here, and that is a great credit to all of our partners. Again, I think part of what I've learned over the last several weeks is that it is pretty easy to flip a switch and turn things off. Turn the economy off, turn society off. You know, when you have the President of the United States and 50 different governors ordering people to stay at home, that, you know, in that way you can pretty quickly and swiftly turn things off. It's not going to be as easy to turn things back on, not at all. It's going to take several weeks, if not months, if not longer. Who knows? We really don't know how long it'll take, but we know that the slow process of getting back to something resembling normal can only happen with testing. It can only happen with testing. And in the last week or so, there's been a lot of discussion locally, statewide, and nationally about you know, the timeline of when things are going to get back to something resembling normal. We see some states, and you know, in Georgia, they're opening restaurants back again, and other states and communities have really started to talk about, you know, how soon we can get back to how we were and what that will look like. Well, whatever the answer to those questions are, begins with testing. None of it can happen. We can't go back to anything resembling normal without testing. And so that is why I am so thankful for the partners involved here today, the health department, Mercy, ProMedica, UTMC, St. Luke's, Neighborhood Health Association, and really most especially the three private companies. The private sector has stepped up and helped us in a way that, you know, maybe in an alternate history the federal government could have done, but no sense crying over spilled milk now. I'm certainly fortunate, glad. I just feel very fortunate that we have corporate citizens like Kroger and Walmart and Rite Aid who are filling the gap and taking the lead on this. So for the foreseeable future, next several weeks, there will be public testing available to all members of our community. And that is an incredibly important step as we talk about returning to something resembling normal. So again, thank you everyone, and I'm happy to participate in this conversation.
Thank you, Mayor. And we'd like to open now to questions from our media partners. You can put those questions in the chat, or if you would like to raise your hand and ask a question of someone, you can do that, and we can give you permission to ask your own question. Melissa Veitch from 13ABC has a question. Mel, go ahead and unmute your microphone and ask your question.
It's okay. I got three quick questions for Eric Skaczynski, who is the health commissioner. First of all, with all of this testing available, do we really have that many people out there who are still walking around COVID positive who don't know it? And do you see this as, exploding our local numbers? Second question is nursing homes. We're still looking for a release of information as to how hard our nursing homes are getting hit and what we're doing to protect our patients inside those nursing homes. So I guess it's two questions.
Okay. The first one, we do know that we have asymptomatic people walking around with COVID. We have this idea of prevalence in the community, whether it's of asymptomatic individuals of 5 to 10. There's been upwards of saying 50%. We don't know. So what this is going to do is a couple things. One, I do believe that there's still people that are symptomatic that could be out there, and I do believe that there's asymptomatic individuals. So what we're going to be able to do here is, again, if those individuals do have those symptoms, and some of them might be slight, we're going to be able to get a much better read on our community, what is happening relative to the COVID issues, and the idea of what we can do then to go forward. So that's why it's so important. The main issue, though, with the testing right now, at least from the public health standpoint, is that we want to catch all those individuals who would be testing positive. So again, we could stop that spread by quarantining, isolating that individual, but then looking at those contacts so that it can't be spread further. Again, this thing, as we've talked about so many times, and I'll continue to state this, it is such a fast driving disease because of the asymptomatic issues and also how infectious it is, that any tool that we can get into our community to help stop that, the better off we are. Let me move on to the nursing homes. You know, there's been so much talk about the nursing homes in our community, throughout the state, throughout the country, and it is a population that is right to have issues because of not only the criteria and characteristics of the nursing home, of those individuals in the nursing home, but then just the way that the processes happen there. So again, it's an issue that we all have to struggle with. I will let you know, internally inside of Lucas County, we have partnered with, again, the same partners that we're talking about today. All the hospitals have come up to bat to help us with the issue inside the nursing homes. That includes some testing, includes help with looking at infection control practices. Also then too, the Ohio Department of Health has had a number of conference calls with us and local nursing homes to look at those very issues as well too, to actually walk through to see how we can help improve the situation inside those nursing homes. And also then too, CDC is making visits throughout the state of Ohio for nursing homes. And again, trying to figure out how we can help all these nursing homes combat the issues that they have internally.
Do we have a lot of cases there?
Do we have? We have a number of nursing homes that have cases, both of residents as well as workers. The number last week was indicative of that. As we go through and look at the data, more and more individuals are presenting with COVID symptoms and are positive. I think too, as we see, which is a good thing, we're seeing additional testing inside of nursing homes, good and bad. We're going to be able to get a better handle on what's happening in the nursing homes. Again, much like the community, inside the nursing homes, if you don't know who's positive, you can't separate those individuals out so that they don't spread that disease. There are several nursing homes that have tested wholesalely, and we'll be able to hopefully get some better information here over the next couple of days of what's happening in several of those nursing homes. Again, it's really important to look at that testing because, again, you can make assumptions of who's symptomatic, of course, but then you can't make assumptions of, again, who might be asymptomatic or symptoms that are just not as severe. So again, this is going to help the nursing homes and us combat those issues inside of those nursing homes and long-term care facilities.
Thank you.
Sure.
Next, we have Roxanne Elias from WTOL. Roxanne, if you can turn on your microphone, please ask your question.
Okay, I believe I turned it on. Can you guys
can hear you?
I wanted to ask, I guess, the testing sites, are there any of the testing sites that will also make translations available for the Spanish-speaking communities or the Arabic communities, or is it only the one location that Neighborhood Health Association has that will offer just Spanish translation for those who come in for testing?
Neighborhood Health Association has, let me turn my camera on for you. Neighborhood Health Association will have Spanish translation at the appointment time. So we'll certainly be able to address the issue of the need for translation as you make appointments. And we will also have translation at the Navarre site. We are investigating providing other languages as well, Arabic being one of them. It's a little more complicated, so we're not starting out with those, but it's our hope to add the ability to translate for other languages pretty soon.
Okay, and then this is, I guess, for the health commissioner. Are you guys getting a lot of calls from I mean, I know you guys are talking about the underserved communities, but these are also the people that can only speak one language. How are you guys, what kind of questions or concerns are you guys getting from those communities at the health department?
We're not seeing a lot of that at this point in time. It is sporadic, and again, I think it goes back to what Donnie Miller is attempting to do. Again, setting up that alternate language, or that other language other than English at the site, so that we can go ahead and make sure that it is covered across the community. That those individuals have a seamless ability to understand not only the testing procedure, but then what they need to do after the test if they are found positive. So again, that second type of language on a community, and or third language, or fourth, as we've done some Facebook Live presentations early on here. Those are all important as well too, and we continue to attempt to address those throughout a lot of our flyers and things of that nature.
Okay, thank you.
Mm-hmm.
Next, we have Brooks Sutherland from The Blade. Brooks, go ahead with your question.
You guys hear me?
Yes.
All right, this is for Eric. So the mayor was just talking about public testing. Do we have a specific number of how many tests we now have in the county that would essentially reflect our capacity to test everyone that, you know, is showing symptoms or needs it?
Well, again, I would like to see a test for everybody in the community, but again, we're looking at those the CDC guidance, and understanding that that test really only is effective if you have symptoms. Again, we won't get into the asymptomatic issues. So what I'm seeing right now is I'm seeing the uptick of tests, and if we're talking over the next month of could be 10 to 15,000 tests if everybody stays on track with the numbers that we're projecting through Walmart and Kroger's and Rite Aid. That's going to be a substantial amount of tests. Is it enough? We won't know that until we go through the next month or so and see, if you would, let's call it the background of COVID in our community. What are we seeing relative to those tests? Are they starting to decrease? Because again, we've talked about the possibility of this virus reacting to warmer temperatures and more humidity. So again, we don't know. All I can say is now we are thankful for the amount of tests that are coming in. It's like the mayor said, it's so much better than it was last week. And I see us getting more and more tests as we go through the next couple of weeks, not only from the private industry, from corporations, but I do believe from ODH as well too.
I'll just follow up kind of to that point. A lot of talk around the nation even about reopening and if we have enough testing. If the governor opens here soon, you know, he's talked about May 1st and eventually getting to some sort of normalcy. Do you feel comfortable where we're at in Lucas County with testing once things start reopening?
Let me just preface by this. I'm more comfortable today than I was 2 days ago. I think as we go through the next couple of weeks, I will become more comfortable. The problem that I think we're going to encounter is that we have testing now, and again, we think that's a cover for us, that we can now go out and do other things that, you know, we may not be positive, so I can go out and, you know, go 6 foot closer than somebody and talk to them, or go out to a gathering. But we can't think that way. We have got to stay steadfast in the idea, just because we have testing, just because we're going to open up hopefully May 1st or somewhere in that time frame, that we go away from social distancing, that we go back to the large parties, we start shopping without a face covering. I mean, those are the things that we can't do. We have to stay the course over the next weeks to maybe months to make sure that, again, we don't allow COVID to come back into our community.
Thank you.
Okay, I want to bring Connie from Kroger back up on the screen. Connie, if you wouldn't mind putting your camera on. Thank you so much. Roxanne Elias, you were asking about other languages, and Connie, Kroger also has the ability to help people with translation, correct?
Yeah, correct. So at our sites for our Kroger testing, we will also have translation phones available that speak multiple different languages that we actually use inside of our clinics today. So those will be available at our testing sites also.
Okay, yes. And then we had another question, Connie, from Sophia Paracone, who's asking, is the Hawkins Farmhouse site open to non-Lucas County residents, like the Rite Aid location is? So are you taking non-Lucas County or just Lucas County residents there?
We will take anybody who is symptomatic for our sites up to the 1,000 tests that we have currently.
Okay, thank you so much. And then the other part of that question, Sophia, you were asking how long Walmart will be taking over that site for, and they plan to be there until the end of May or whenever testing can whittle down. So through the end of May is what they're planning for right now. Okay, Amy Steigerwalt from WTOL also has a question. Amy?
Hello.
Hi.
The question is probably for the health commissioner. As we see more testing happen now, do you expect our numbers will increase and we may learn of some hotspots in our community? And I guess how will that affect, you know, allowing people to social distance and allowing things to reopen?
Sure, that's a good question. I do expect us, again, to see increase in positive cases, which then will increase those contacts, which then probably will increase those probable cases. So again, the important thing here is it's not a good thing. Okay, let's cut to the chase. It's not a good thing to have positive individuals, but if we know where they're at, and then we can go back and do that contact tracing, and again, like we've been talking about, I've said a couple times here, the ability for us to then isolate those individuals from others until the disease runs its course, the more that we have the capability of stopping this thing from running through our community. So again, when we start talking about positive cases, nobody wants to see positive cases, but when we do that, that's a good thing for public health, because then we can start getting a better handle on what's going on in the community. And that's, we've fought this thing with one hand tied behind our back. We really have. We've done a great job, and it's because of this community that we've been able to combat it as much as we've been able to. But as we bring testing online, that's a very powerful tool for us to be able to react to COVID much better and to limit the capability of this thing running through our community.
Thank you.
Okay, and while we're waiting for any other questions, Health Commissioner Jasinski, we still want people to understand that if they are showing these symptoms, even if they don't go out and get tested, that they probably do have COVID, and we're going to count them in our probable cases as we move forward. And you also are continuing with your health survey, asking people to fill that out if you have symptoms as well, to help you get that data into the health department.
Yes, thank you for bringing that up. Those surveys are still very important if you're not getting tested. And why is it so important? Again, as we collect that data, we're able then to find out a couple things. One is where our hotspots are, possibly, the idea of the symptoms in our community, and then actually you were going to be using that tool now to look at those probables, because if they haven't been tested, they went on that survey, they said that they had symptoms. We will be making those callbacks. I've been working with the University of Toledo, and we're going to be able to get onto those calls and talk to those individuals and get some more information. Again, it's another tool that we can use, again, to limit the spread of this disease. And every tool that we have, the better off this community is to limit the ability for this thing to run rampant and or to rear its ugly head again, or severely rear its ugly head again in some sort of second wave, if you would, and we've talked about that. So again, all these things that are being put into place now will carry into the future, so that again, we have sentinel sites, if you would, to be able to give us an idea of what's happening in the community sooner than what we had before, because we know now what to kind of expect in the coming months. And if we do have that second wave, we'll be able to react better. We have better systems in place, and we have this idea of protecting the community, much like a battle or a war against COVID. We're going to be better prepared in the future.
Okay, thank you, Commissioner. And I don't see any other questions. So if we could have all of our panelists please turn their cameras back on. And Sarah, if you're able to kind of show the box to box to box. We want to thank all of our panelists for being here today and for being part of this. And remember that all of these testing sites, you must be showing symptoms and you must make an appointment to be able to go in and get tested over the next upcoming weeks as they come online. And we want to thank all of you here for being part of this today.